you're doing. So we'll transition now. I'll have the other panelists join us and we will answer your questions. There's a lot of great questions that we've gotten so far. So thank you everybody for listening and being here, and we'll try to get to as many as possible. So some questions are for everyone, some are specific. So I'm gonna start with a question for everybody. I really like this question. How do you build trust between stakeholders who haven't been able to build a relationship with one another? Or is trust necessarily relationship-based? So anyone feel free, one of our panelists, to take that one.
Well, you and Nathaniel were just talking about data, so that's certainly a good place to start. Peer-reviewed, evidence-based, large data set, clinical trials, high-fidelity data. So certainly that's one piece of trust building that doesn't involve the relationship itself. I think we have to be aware of this other one, but existing partnerships. So has it been implemented across Denmark or across the clinical care paradigm in another setting, is at least an indication that it's been reviewed by another stakeholder in a similar setting. And that's a place to see that adoption has been possible and to get feedback from that team.
Good points. Anyone else?
I would agree with that. I think the data piece, I think one of the other things is if you're kind of a stakeholder or you're trying to also roll things out, if it's not an area of expertise, what I would also look for is for groups that are actually reaching out to specialists in those areas to get iterative feedback and are like seeking out like what is missing, what isn't working. Because I think if from one view, if you can say that like I'm doing this, or there is a scientific advisory board, if you will, for the project, at least you know they're looking for those best practices and making sure that whoever's providing it is also someone who has that specialization in all these different areas.
Really, that core science. Yes, that was one of our keys for building trust. Okay, awesome. All right, so now I have a question directly from Marie. How do large companies and their handling of or mishandling of big data and digital technology, so companies like Amazon, Google, Facebook, how is that influencing public perception of digital health in Denmark?
Well, I guess it has an impact in Denmark. We are discussing very much the role of big tech, and I think that impacts the general public's perception and also expectation of digital mental health services. Lacey, you talked about that. Having high expectations is also generated by the large, big Google, Amazon, Apple's tech solutions. The problem is that sometimes they're just not safe enough, and they're not safe enough for being used in a healthcare setting. So during the pandemic, we had to very we had this emergency situation where we had to shift to virtual care within days, and our hospital permitted the use of FaceTime for a very short period, and I think that drove the expectations of our clinicians to the roof, because the service was so easy to use. The problem was just that, well, FaceTime is not a secure, it's not authorized for patient contact in Denmark, so we had to try to revert to our secure, not that user-friendly video solution, and that caused a lot of frustration. So it impacts, of course, on the implementation, of technologies.
Yeah. Very interesting. Okay, because you always think, they're just in the US, but right now with technology, this information goes everywhere immediately as well. So has it impact, globally on our sense of trust and trust in technology? Okay, another question for everyone. So how do we win the trust or buy-in of Indigenous people, minorities, people of color who have been historically discriminated and exploited? That's a good question.
I think it's important for us to be honest about who has used the technology before. I always look at the marketing of technology products to see, are they marketing to a specific group? Are they saying this can be used by everyone? Are they including minority groups? Are they, how are they marketing their products? Who has it been tested on? And who are the recommended populations? And I think being clear about that and having that a part of your messaging helps gain the trust, because saying this can be used by everyone, but you've only tried it on one ethnic group, I think, that increases the mistrust gap, or they don't see anyone that looks like them in the marketing. They may not trust the tool or the technology. So I think it's important to be clear about who the technology is created for and has been tested on.
I think that's so important, right? Let's test it, right? The research is based on populations, right? That all of these populations, and adjusted then based on those findings. We are responsive to those findings and are creative in those solutions, right? We think about the individual and what kind of their sense of mistrust is and how that's culturally based, and develop technologies that are specific to these populations, but then also validated, right, as being helpful and not hurtful. That's super important. I think your marketing thing is really important too, right? Pictures, even simply. Pictures of people. Yeah, Marie.
Yeah. Can I just add that I think concerning this, I think it's also extremely important to involve users with different ethnic backgrounds from idea of a technology solution through developing the digital service through to implementing scaling. So we have to, I think, service user co-production in Denmark is very high on the agenda. So involving collaboratively working with different service users in order to address their particular needs when developing digital mental services.
Yeah, so even before the studying or implementation, really from the beginning, from the idea. Yeah. That makes a lot of sense. Okay, so we're gonna do another question. This could go, the person said for Lacey, but also I think Nathaniel can also chime in on this one. Maybe Marie too. What are some of the challenges you face in integrating digital technology on inpatient units?
And the biggest challenge for new tools that I'd like to bring is physical safety. The challenge is, has my team tested it to make sure if we're bringing a new product and its hardware, can it be broken? Can it be used for self-harm in the inpatient psychiatric setting? So the biggest challenge is us being, 3 steps ahead of our adolescents. Those kids can figure out anything in ways with this technology. So we have got to do our due diligence. So the biggest challenge is making sure that it's safe.
Yeah, and physical safety, but also digital safety too. Can they post to social media? Things like that. That is very complicated, making sure, and these, especially the adolescents are so savvy. Talking about the dark web, all sorts of stuff, they know so much. So there's a digital safety, also physical safety, but safety is such a huge part, especially implementing technology in these more acute or intensive settings. Yeah, that makes a lot of sense. Nathaniel, thoughts?
Yeah, I think, Lacey, as you said, safety is the big piece. And one of the other pieces that I think would come up is also just how quick the turnover can be and how unpredictable the length of stay can be. So I think one thing that I know Justin Baker and others at McLean have been working on this in the inpatient setting too, and doing a wonderful job on that front. And I think with any implementation, it's how quick can you effectively roll it out so that it serves its intended value when you don't necessarily know when the discharge date is going to be or what's next as you're figuring that out. I think there's that adaptability and flexibility to an ever-changing landscape for an individual when they're in an inpatient setting as well.
Yeah, makes a lot of sense. Okay. All right. Another question for everyone. Can everyone talk about, sorry, just moved, how research can build trust with participants and research studies and pilots when that collects sensitive or private data. So especially collecting mental health data, how do you ensure trust, but then also ultimately their privacy and maintaining their confidentiality?
I think this comes up. This is one that comes up a lot in like on clinical units when we're doing research, especially with anxiety, OCD. But I think that the first part really is kind of having a face to the research project, someone that they know who it is, they know who they're affiliated with, and the transparency piece of like, what exactly is it that we're doing? What feedback will you or won't you get? What can you expect from it? How is this going to be helpful? And whether or not this is going to be helpful for you and your treatment, or is it helpful for the field as a whole? Because I do think that sometimes that's one of the challenges is both the transparency, but also knowing like, who do I talk to if I have a question? And putting a face to that is consistent so that they always know, oh, so this is who's running that project. I can always ask for if a question comes up unexpectedly, but also having everyone have awareness of the project and examples of what you've learned from it, kind of giving that feedback back to clients as quick as possible.
Yeah, sharing of information, but I also like what you said. So sharing of information, but maybe one or two only people that are consistently involved in the project, right? There are so many things going on inpatient units and so many transitions and sometimes chaotic emotional and behavioral states, right, of the unit. And right, so having some consistency in the delivery of that information regarding the study and the same face. I like what you said, the same face for the study. I think that's huge. Yeah, Marie.
Yeah, we are also working with peers or patients with people with lived experience of having a mental health disorder. So we have peer co-workers within our research projects, and they can also talk to other patients about participating in the research and explaining why it's important in a recovery perspective. I think that's also a way of building trust, focusing on what's valuable, what's valuable in the research to in an everyday perspective.
Yeah, makes sense. All right, we just have 3 minutes and I'll do one last question. And I think, data privacy has been in the news quite a bit and we think about it and definitely has a relationship to mistrust. So how much does our approach to the question, who owns the data, can influence the trust of participants, patients, clinicians, anyone involved?
I personally ask that question up front to every single vendor that we interact with. That's the first question I ask. Who owns the data? Where is it stored? Who has access to it? And so that is just our security criteria checklist before even introducing the technology. So I think it has a lot to do with the approach of us adopting a new technology and what the vendor has plans for the data and how can we be upfront and gather consent for how that data is shared and used. So
I do think that's why trust is higher among the provider initiated solutions rather than the employer based or the consumer products, because there's that existing trust in the provider community in general. And then there's certainly those other layers of privacy and protection that a clinical setting is held to that these other settings are not. And that can add trust into the relationship and in general does.
Mm-hmm.
One other aspect I think to the trust that's important from like the client's perspective is also understanding being clear with them, like who owns it and letting them ask questions about it, but also giving a chance to understand and listen to what their concerns are. Because I think one of the things that comes up the most actually has to do with stigma and shame and the fear of like, what if it's mishandled? What if I'm found out? What if it isn't de-identified correctly? What are the repercussions for me, my family, my career, my job, my career, et cetera? And I think that's, that stigma piece is a valid concern. And spending time actually talking to people about what are the concerns, what might happen in these, what is the true pro and con benefit risk, acknowledging both of those can be also really helpful and kind of like taking a motivational interviewing approach to helping people decide if it's right for them.
Awesome. All right. We are out of time, and I apologize we weren't able to get to all the questions. Thank you for joining us today. Just really tremendous message, I think, from our panelists. Really, the themes I heard are the importance of science, safety, and ultimately that we never forget with technology, it's about people. And we have to always remember that. So thank you for joining us today.